لا إله إلا الله لا إله إلا الله لا إله إلا الله ما لنا رب سواه. All right, I think we are going to get started, and as people trickle in, they'll be able to listen in as they go along. So, assalamu alaikum, everybody. Hello, welcome. Thank you all for joining us. I'm very excited, and I think we all are excited about this event that's happening. So if some of you may know, Ramadan, the holy month of fasting, is soon approaching us. So inshallah, this year will be on Saturday. So we wanted to take this opportunity to answer all questions, kind of inform people why Muslims fast. If you have any outstanding questions, hopefully this event will be able to answer those questions for you. So we have invited Dr. Ghasser Hathout. He is a professor in the Department of Radiology at the David Geffen School of Medicine at UCLA, and he's also the Chief of Neuroradiology at the Greater Los Angeles Veterans Hospital. So we are very excited for him to be here. Just a few announcements before he gets started. I am recording this event. Hopefully we want to share it with future classes and use this as an educational tool for in the future. And then at all during the event, if you have any questions, I have put a form in the chat as you are listening. If you have any questions, you may put those and we will monitor those as we go. So the floor of yours, Dr. Hathout, take it away.
Thank you very much. Assalamu alaikum. Peace be upon you. Thank you very much for inviting me. What I was asked to speak about, just to put it in context, was I had done a series of lectures on the health benefits of fasting. So I will begin with sort of the spiritual purpose of fasting, but I will spend most of the time on the, I guess you would say, medical issues involved, so that we're aware, and I will also note why it is that I'm doing that. But thank you so much for inviting me. I'm honored to be sharing some of this material with you. So why do we as Muslims fast? Well, the answer is given in the Quran, the holy book of Islam. I will quote only one verse in Arabic, and then after that I will not go into Arabic, but أعوذ بالله من الشيطان الرجيم يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. O you who have attained to faith, fasting is ordained for you as it was ordained for those before you, so that you might remain conscious of God or attain God consciousness. And so the purpose of fasting is a spiritual exercise, to put the physical needs and physical urges sort of on the back burner or in the back seat and focus on spirituality. So the outward manifestation is that Muslims do not eat and do not drink from dawn until sunset, but the genuine purpose is spiritual purification as it was ordained for those before us. So we are one in a long line of co-religionists among Jews, among Christians, among Buddhists, and others who fast for spiritual purification. And that notion of spiritual purification can be seen in the teachings of the Prophet. He said that fasting is a shield, so when somebody is fasting, he should neither indulge in obscene language, nor should he raise his voice in anger. If someone attacks him or insults him, let him say, I am fasting. And so fasting becomes a sort of way to elevate our behavior. And he also said that whoever does not give up false statements, the telling of lies and evil deeds, and speaking bad words to others, God has no need of him to give up his food and drink. And so the general consensus is that if one simply abstains from eating and drinking, but does not elevate their behavior and their level of spiritual purification, then, as the saying goes, they have gained nothing from their fast except hunger and thirst. So that's why we fast. But the Quran, there's a long verse here talking about if you're unable to fast and so forth, and I'll address some of that in some of the very insightful questions that I was given. But the verse says, if you fast, it is better for you. If you're able to do it, know that it's better for you to fast. And the question that the scholars of Islam have wrestled with for a long time, and I shouldn't really say wrestled with, they have a pretty consensus opinion that we are not here to play a cosmic game of Simon Says, that whatever commands we are given are not only for our spiritual good, but also for our physical good. And so the question before us, when the Quran says that fasting is better for you, does it mean spiritually only or also physically? And that will be the topic of our address. And as some of you may be familiar with, the field of neurotheology, for example, a new and emerging field, is showing immense psychological and physical benefits of prayer, as another example that when one follows these commandments, it is good for this world and for the hereafter. So now in terms of the physical benefits, this is a quote from one of the sources that we'll be using, that perhaps the first evidence that intermittent fasting, and there'll be a lot of terms for intermittent fasting, periodic fasting, alternate day fasting, I'll just say fasting. Perhaps the first evidence that intermittent fasting may confer widespread health benefits came from studies in which rats maintained on alternate day fasts, beginning when they were young, lived nearly twice as long as rats on an ad libitum diet. Ad libitum means eating as you wish. That's where, the term ad lib comes from. So when alternate day fasting was initiated in middle age, the rats lived 30 to 40% longer. ADF also results in the preservation of cognitive function and sensory motor function during aging in rodents. So this was the first big evidence that fasting actually can have fairly immense physical impact. And what I will do, I will show you the sources that we'll be using, and what I'll be doing is essentially quoting from these sources. I'm not here to give you my opinion, and we will use a couple of respected internet popular sources and a few medical literature sources. So here's one of the sources that we will be using. And basically it's saying that fasting is commonly associated with the month of Ramadan. As you read this, billions of Muslims around the world are engaged in this declaration of faith that involves abstaining from food and drink. While fasting Ramadan is down to spiritual beliefs, many of us choose to fast with the belief that it benefits our health, but does it? So that is the question before us. And the answer that the article gives, that a number of studies have suggested intermittent fasting has numerous health benefits, including weight loss, lower blood pressure, and reduced cholesterol. Here's another source, Authority Nutrition, this article by Chris Gunners, 10 evidence-based health benefits of intermittent fasting. The article is very well sourced from the medical literature. I highly recommend it, even though it is a popular internet site. Everything he says is medical literature sourced. And basically, numerous studies show that fasting can have powerful benefits on your body and brain. And he goes through 10 evidence-based health benefits of intermittent fasting. And so we'll use that as sort of our template as we move forward. And as you know, with all of the various diets, fad diets and non-fad diets, fasting has now actually become, I believe, the most popular diet in the US. And that's been, something that's only a decade or so old, or even less than that. Then literature sources from Journal Nutrition. It's a review article. You all know what a review article is. They will go through the medical literature and review it. So it gives us a nice summary. Unraveling the metabolic health benefits of fasting related to religious beliefs, a narrative review. Another, and in that article, they basically say that advantages of religious fasting are claimed by many, but have been explored mainly by a limited number of studies conducted in Buddhist, Christian, or Muslim populations. These trials indicate that religious fasting has beneficial effects on body weight and glycemia, cardiometabolic risk markers, and oxidative stress parameters. And importantly, the exact mechanisms of the role on human health remain unclear. We'll touch on some of the stuff that's being explored now in terms of the biomechanisms involved. And previous results indicated potential beneficial effects, including prevention of certain diseases such as obesity, diabetes type 2, and cardiovascular disease. So that's from that source. Another source is Aging Research Reviews, impact of intermittent fasting on health and disease processes. And another source is from the Journal of Behavioral Sciences, potential benefits and harms of intermittent energy restriction. Again, a narrative review of human and animal evidence. So whenever I put something up, you will see which source it comes from so that you're comfortable that I am sourcing my material. And we will be talking about human data and animal data because, of course, it is much easier to do large-scale experiments well-controlled with animal data. So again, you will see the logo of where the quote comes from. And the bottom line, in laboratory rats and mice, fasting has profound beneficial effects on many different indices of health, importantly can counteract disease processes and improve functional outcome in experimental models on a wide range of age-related disorders, including diabetes, cardiovascular disease, cancers, neurological disorders such as Alzheimer's and Parkinson's and stroke. So that's the bottom line. It is very beneficial in terms of animal models and with some reasonable data in human populations as well. And now talking about the human data, studies of fasting in normal and overweight human subjects have demonstrated efficacy for weight loss and improvements in multiple health indicators, including insulin resistance and reductions in risk factors for cardiovascular disease. Now, what are the mechanisms? Well, that is beginning to be teased out. The cellular and molecular mechanisms by which fasting improves health involves activation of adaptive cellular stress response signaling pathways that enhance mitochondrial health, DNA repair, and autophagy. And it also promotes stem cell regeneration, as well as what seem to be fairly long-lasting metabolic effects. And from this article, we can see that hormone levels are involved. Insulin levels, for example, drop significantly, and that facilitates fat burning. And it also mitigates against insulin resistance in diabetes. Human growth hormone levels can increase as much as 5-fold, facilitating fat burning and muscle gains. Cellular repair is improved, as well as autophagy and removing waste material from cells. And at the bottom of all of these, it seems that it is mediated, at least to some extent, by epigenetic effects. And you all know what epigenetics is. We're not altering our DNA, but we are simply affecting gene expression. Okay, so now let's begin the topic-specific review. First, weight loss. And you all know, being in the medical field, that even a modest degree of weight loss, 10 to 15 pounds, can have a profound impact on cardiovascular health, on diabetes, etc. And fasting has demonstrated the benefit of 3 to 8% weight loss over 3 to 24 weeks, 4 to 7% reduction in waist circumference, and importantly, loss of visceral fat, which is the bad belly fat that puts us most at risk. And this is, by the way, and we will touch on it maybe a little bit more later, simply going for long periods without eating. You will lose weight doing this, even if you take in the same amount of calories, but in a frequent meal pattern. So part of it, of course, is you tend to reduce calories when you fast, but even if you don't, it has beneficial effects. And it has been shown that there are lower insulin levels, higher growth hormone levels, increased amounts of norepinephrine, all increase the breakdown of body fat and facilitate its use for energy. And for this reason, short-term fasting actually increases the metabolic rate, which may be counterintuitive to some, by 3.6 to 14%, helping us burn even more calories. So intermittent fasting really works on both sides of the calorie equation. It boosts the metabolic rate and reduces the amount of food you eat. And so that is where the weight loss comes from. Now, another topic, diabetes. So from this article, put simply, IF, intermittent fasting, can prevent and cure the disease in rodent models of type 2 diabetes. You can't really have a stronger statement than that. The cellular and molecular mechanisms by which it prevents and reverses diabetes involves increased sensitivity of insulin receptor signaling, such that insulin more readily stimulates glucose uptake by muscle and liver cells, unlike other cell types, including neurons. and changes in other signaling pathways are affected by intermittent fasting in one or many cell types, and they include, for example, reductions in mTOR signaling, improved mitochondrial function, stimulation of mitochondrial biogenesis, etc. So intermittent fasting, through epigenetic effects, does all of this. And I don't know if you have yet in physiology or biochemistry studied the importance of the mTOR complex in controlling, being the sort of master regulator of the cell's metabolism. mTOR stands for the mammalian target of rapamycin, or the mechanistic target of rapamycin for historical reasons. And of course, the slide is way, way, way too much to take in. I'm just putting it in for us to appreciate the dizzying complexity of intracellular pathways. mTOR is actually two complexes, mTOR complex 1, mTOR complex 2, each of them made of a few different proteins with a myriad of effects and feedback loops that control cellular metabolism. And for those of us who believe that this complex array of feedback loops is designed and did not come about haphazardly, it's always good to take a little bit of a look behind the curtain to sort of understand. And to the best of my knowledge, we are as yet entirely unable to simulate the intracellular networks. We can simulate bits and pieces of pathways through feedback loop calculations, but the entire cell, or anywhere near the entire cell, is beyond our computational capability at present, to the best of my knowledge. It's a bit outside my area. So continuing with diabetes. So anything that reduces insulin resistance will help lower blood sugar levels and protect against type 2 diabetes. And intermittent fasting has been shown to have major benefits for insulin resistance and lead to impressive reductions in blood sugar levels. So in human studies on intermittent fasting, fasting blood sugar is reduced by 3 to 6%, while fasting insulin is reduced by 20 to 31%. And of course, the less insulin we have bombarding our insulin receptors, the less likely we are to develop insulin resistance, which is at the heart of type 2 diabetes. And one study in diabetic rats also showed that intermittent fasting protects against kidney damage, which is, of course, one of the most severe complications of diabetes. And so this implies that intermittent fasting may be highly protective for people who are at risk of developing type 2 diabetes. We will, of course, need a lot more human trials to confirm that. Okay, continuing with diabetes from this source, studies have reported greater reductions in insulin resistance versus CER. CER is continuous energy restriction. So you can think of it, for example, as taking in few calories, but doing it often, like the grazing diet, where you're constantly sort of eating small amounts. So if you go long periods without eating, you will have better reductions in insulin resistance among overweight and obese non-diabetic patients. And in one study, the subjects on the fasting diet exhibited a 25% greater reduction in insulin resistance compared to the CER group. And these differences in insulin sensitivity occurred despite comparable reductions in body fat between the groups. So again, very important statement on just the mechanics of the fasting and its effects. Okay, so now a new topic, cardioprotective effects of fasting from this source. So profound cardioprotective effects have been documented in studies of rats and mice. In a model of myocardial infarction, rats that had been maintained on alternate day fasts for 3 months prior to MI exhibited a reduced myocardial infarct size, and the number of apoptotic cells in the area at risk in the penumbra zone was reduced by approximately 75% compared to ad libitum control rats. And again, cardioprotective effects. Fasting was reported to greatly improve survival and recovery of heart function in rats when initiated beginning 2 weeks after the MI. And whereas more than 75% of the rats on the fasting diet survived during an 8-week post-MI period, less than 25% of the rats on a normal ad lib diet survived. And so we see that fasting not only has cardioprotective effects in hopefully helping prevent MIs, but even when a fasting regimen is begun after an MI, there's a very significant survival benefit to doing that. And studies have reported beneficial reductions in serum cholesterol. Why does it have a cardioprotective effect? Well, reductions in serum cholesterol and triglycerides, markers of oxidative stress like 8-isoprostane, nitrotyrosine, protein carbonyls, etc., and inflammatory markers like tumor necrosis factor. And most studies of fasting summarized in the recent reviews show benefits in terms of reductions of weight, like we've discussed, reductions in body fat, particularly the visceral fat, reductions in total serum cholesterol, 10 to 21% reductions, triglycerides, 14 to 42% reductions, as well as improvements in glucose homeostasis. So we end up reducing so many of the risk factors for bad cardiac outcomes. And when initiated in 2-month-old rats, fasting protected the heart against age-related increases in inflammation, oxidative stress, and fibrosis, and the age-related increases in the myocardial extracellular signal-related kinases, the phosphoinositol kinases, the STAT3, the signal transducer and activator of transcription factors, were all prevented by ADF, and these are all pro-inflammatory, pro-oxidative stress hormones and proteins that fasting significantly reduces. Now, in the human population, hypertension, low heart rate variability, insulin resistance, and hyperlipidemia are all associated with increased cardiovascular disease and stroke, and fasting reduces all of them. It reduces all of the risk factors, basically. It reduces blood pressure, it increases heart rate variability, and this is becoming a very interesting area. You know, somebody who's so happy that their heart rate is 70 no matter what they do, that's not great. You want good heart rate variability. It reduces insulin resistance in laboratory rodents, as we've talked about. And it's known that various health markers that are associated with increased or decreased risk of heart disease, and fasting works on all of them in the beneficial direction. Intermittent fasting has been shown to improve numerous different risk factors, including blood pressure, total and LDL cholesterol, triglycerides, inflammatory markers, blood sugar levels, as we've discussed. But a lot of this is based on animal studies, and the effect on heart health needs more study in humans. But the bottom line, studies show that intermittent fasting improves numerous risk factors for heart disease. So we would anticipate that there should be some beneficial effect on humans as well. We don't have the sort of rodent data of, you know, fasting pre-MI, fasting after MI, and so on. But certainly the risk factor data for humans is there to at least give us hope. Okay, now antioxidant and anti-inflammatory effects of fasting. Everybody now is aware of the issue of antioxidants and how oxidative stress is very damaging. And it involves free radicals that react with other important molecules and causes damage. That is what oxidative stress does. And several studies seem to show that intermittent fasting enhances the body's resistance to oxidative stress. And studies show that intermittent fasting can help fight inflammation. And the bottom line is that intermittent fasting can reduce oxidative damage and inflammation in the body, and this should have benefits against aging and development of numerous diseases. So again, continuing with antioxidant and anti-inflammatory effects from this source, getting into a little bit more detail, the possible antioxidative effect of Ramadan fasting was evaluated. So human trial was specifically for Ramadan fasting. It included 50 fasters and reported measurements of the pro-inflammatory cytokines, interleukin-1b, interleukin-6, and tumor necrosis factor alpha. And it showed significant reductions in these cytokines compared to baseline, reductions of 78% for interleukin-1b, 57% for interleukin-6, 71% for tumor necrosis alpha. Tumor necrosis factor alpha, forgive me, And interestingly, the interleukin-6 levels remain significantly low 1 month after the end of Ramadan fasting, implying a potential long-term beneficial role of Ramadan fasting on the inflammatory profile. And again, just to take a look beneath the surface, here is a ball and stick diagram of interleukin-6. And as a cytokine, it will affect a lot of immune cell targets as well as fibroblasts that are involved in scarring. So reductions in interleukin-6 through all of its various target response areas should have a significant beneficial effect in terms of reducing the body's inflammatory response. And one example, interleukin-6 activates the phosphoinositide 3 kinase, the PI3K pathway. Again, just taking a little bit of a look beneath the surface at the molecular mechanisms. And a downstream target of this pathway is protein kinase B. So interleukin-6 activated prokinase B will then phosphorylate nuclear localization signal areas on DNA methyltransferase 1, DNMT1. This phosphorylation then causes DNMT1 to migrate into the nucleus. It recruits other DNMTs, so DNA methyltransferases, and as a complex, they recruit HDAC1. And what does all of this complex pathway do? It adds methyl groups to CpG cytosine phosphate guanine islands on gene promoters. And when this is done, it inhibits the transcriptional machinery from accessing the gene to induce transcription. So this would be one epigenetic pathway of how fasting works. And increased interleukin-6 will hypermethylate DNA sequences and subsequently decrease gene expression through its effects on the DNA methyltransferases, because it will add methyl groups to gene promoters that will inhibit the transcriptional machinery. And so, for example, depression and major depressive disorders, the epigenetic effects of interleukin-6 have been implicated in the pathway for depression because this inhibition will, for example, repress the synthesis of brain-derived neurotrophic factor, BDNF, which is healthy for the brain to have, and low levels of it have been implicated in depression and other major depressive disorders. So you can see that we're beginning to unravel some of the metabolic pathways. Now, in terms of pro-immune response of fasting, so a study from this source, a study conducted by Dr. Walter Longo and colleagues at USC, found that longer periods of fasting may even, quote, reboot the immune system, clearing out old immune cells and regenerating new ones, a process they say could protect against cell damage caused by factors such as aging and chemotherapy. And basically, when you starve, that's why it takes longer fasts, the system tries to save energy, and the immune system is very expensive in terms of energy. And one of the things that you can do is recycle out or get rid of the old, poorly functioning immune cells, the damaged ones. Detoxification. So Dr. Razin Mahrouf at the University of Oxford says that fasting causes a detoxification effect because toxins stored in body fat are dissolved and removed from the body as the body sheds that fat during fasting. Related to all of this, cellular repair and autophagy. When we fast, the cells in the body initiate a cellular waste removal process called autophagy. I know you're all very familiar with that. We will break down and get rid of old cells, as well as break down and get rid of basically the protein garbage, dysfunctional proteins in the cells. And you all know that these dysfunctional proteins, like fibrillary tangles, like plaques, from amyloid proteins, from tau proteins, and so on, are implicated in a major way in such things as Alzheimer's disease, as well as possibly in cancer. And fasting triggers a metabolic pathway called autophagy, which removes these waste materials from cells. So how about cancer specifically? Studies here are extremely impressive, but they are, of course, animal-based studies. So recently, a series of studies in animal models have shown that periodic fasting, lasting 2 or more days, can be as effective as chemotherapy in delaying the progression of a wide range of cancers, but more importantly, can protect normal cells from the toxic effects of chemotherapy drugs while sensitizing cancer cells to the treatment. So we delay the onset and progression of cancers. We protect normal cells from toxic effects of chemo, and we sensitize cancer cells to chemo. And a severely restricted diet that mimics periodic fasting started at middle age was effective in causing major reduction in tumor incidence, in addition to delaying tumor onset and reducing the number of sites where tumor-like lesions, suggesting a reduction in metastatic cancers. So this is animal data. We, of course, share a reasonable amount of physiology with mammals, so would be expected to at least somewhat carry over into humans, but we're certainly not going to tell someone that, hey, the data says fasting is as effective as chemo, don't take chemo, but we see that it can have beneficial effects. We do not have data on the effects of intermittent fasting on cancer rates in humans. That would take a controlled study that would go on many, many, many years. But we have some suggestive pathways as to how this could happen. We've talked about weight control, and weight control is likely to reduce the incident risk of at least 13 cancers. We know a lot of cancers are linked to obesity. So this would be called sort of surrogate evidence that intermittent fasting may reduce cancer risk. And so it can be derived from its effect on a number of cancer risk biomarkers: insulin, cytokines, the inflammation-related molecules such as leptin and adiponectin that mediate the effects of adiposity on cancer, and significantly, reductions in insulin-like growth factor 1 of about 15% have been reported in normal and in overweight subjects who followed an intermittent fasting diet interspersed with normal intake for the remaining 25 days of the month. So you see that even a rather sparse intermittent fasting diet can have significant reductions on insulin-like growth factor 1 in humans. Why is that significant? Well, here's a little blurb from the Harvard Gazette. This is a quote from that. High levels of a well-known growth factor significantly increase the risks of colorectal, breast, prostate cancer, medical researchers have found. And what they were talking about is insulin-like growth factor 1. And here's something from the Proceedings of the Nutritional Society: diet, insulin-like growth factor 1, and cancer risk. And basically what this blurb, this abstract here is saying is that, this is a difficult area to establish results, but the importance of particular foods and nutrients is not clear. Part of the difficulties are poor understanding of the physiologic changes that may mediate the effect of diet on cancer risk. But recent research and prospective studies with biobanks of stored blood samples have shown that the serum concentration of insulin-like growth factor 1 is positively associated with the risk for breast cancer in women and prostate cancer in men. And it's known that circulating IGF-1 concentrations can change in response to nutritional changes, including energy and protein restriction. And basically the bottom line, I won't read through this whole thing in the interest of time, but we have surrogate evidence that insulin-like growth factor 1, among a variety of other molecules, is reduced by fasting, and high levels of these molecules put us at increased cancer risk, even though we do not have a controlled human study on diminution in rates of either tumor incidence or tumor progression in a fasting versus non-fasting population. So again, from this internet source, fasting has been shown to have several beneficial effects that may lead to the reduced risk of cancer. Although human studies are needed, promising evidence from animal studies indicates that intermittent fasting may help prevent cancer. And what I'm doing is just showing you that multiple sources concur on the same lines of evidence. I'm not just picking one source that makes the case that fasting is good for us. And there is some evidence on human cancer patients showing that fasting reduced various side effects of chemotherapy. So there's really one paper that has shown that the side effects of chemo are blunted by fasting in the human population, but intermittent fasting has certainly been shown to help prevent cancer in animal studies without a doubt. And it may be a little paradoxical to you because I think our natural response, if we have a patient with cancer, or if God forbid a family member ourselves with cancer, I think we would think, well, I need to keep up my nutrition so I can fight the cancer. Many of you, I'm sure, know what you're looking at here. It is a PET scan, positron emission tomography, where fluorine-18 tagged radioactive glucose is injected. And this stuff here is the collecting system of the kidneys, the ureters, the bladder, so ignore all of this. But what you're seeing here are the glucose-avid tissues in the body, tissues that have a high metabolic rate. You could see that in the normal human, the brain is first and foremost. In this patient, there is a large right lung cancer, which is even more metabolically active than the brain. So when you eat well to try to fight the cancer, you're really feeding the cancer more than you're feeding your cells. Or put another way, probably a more accurate way, what tissue will suffer the most from restricting energy intake? What tissue has the highest metabolic need? Well, the cancer has the highest metabolic need of anything, with possibly the exception of the brain. So cancer gets hurt the most. Just like, for example, when we have someone who suffers a hypoxic or anoxic incident, the highest metabolic active tissues in the brain, or highest areas of energy consumption in the brain, such as the basal ganglia, the hippocampal formations, and the Purkinje cells of the cerebellum, suffer first and infarct first. And so, you can put it in that sort of context. And lastly, just try to spend a couple of minutes on brain health. That usually what's good for the body is good for the brain. And intermittent fasting has been shown to improve various metabolic features important to brain health. Again, reducing oxidative stress, reducing inflammation, and reduction in blood sugar levels and insulin resistance. And several studies have shown that intermittent fasting may increase the growth of new nerve cells, which should have benefits for brain function. And we've already gone through the pathway by which intermittent fasting increases the brain-derived neurotrophic factor, a deficiency of which has been implicated in depression and various other brain problems, as we've discussed. So intermittent fasting may have important benefits for brain health. It may increase the growth of new neurons and protect the brain from damage. And intermittent fasting may help prevent Alzheimer's disease. So in a series of case reports, lifestyle intervention that included daily short-term fasts was able to significantly improve Alzheimer's symptoms in 9 out of 10 patients. This would need to be more accurately looked at, but it's certainly promising. And animal studies suggest that fasting may protect against other neurodegenerative diseases, including Parkinson's and Huntington's. So studies in animals suggest that intermittent fasting may be protective against these neurodegenerative diseases. Here, by the way, just for your interest, a normal brain and a patient with Alzheimer's, there's generalized atrophy in the Alzheimer's brain. That's why the lateral ventricles and the third ventricle are larger than the normal subject. But what takes the hardest hit are the hippocampal formations. Here are normal hippocampal formations, and here are the atrophied hippocampal formations in someone with Alzheimer's with expanded temporal horns of the lateral ventricles. Rates of neurofibrillary tangles and plaques are highest here and in the nucleus basalis of Meinert in the basal forebrain, a cholinergic relay center. And that's why some of the anti-Alzheimer's drugs are, cholinergic based. There's a very clear physical substratum that fasting may be able to impact. And so the degeneration and death of neurons that occurs in these disorders is believed to be secondary to impaired mitochondrial function, oxidative damage, impaired lysosome function, dysregulation of cellular calcium homeostasis. And when rats were maintained on alternate day fasts for several months prior to administration of kyanic acid, their hippocampal neurons were much more resistant to degeneration. And mice maintained on alternate day fasts for several months are more resistant to MPTP. This is a synthetic drug, was a big epidemic. I don't remember now if it was in the 80s. Recreational use of MPTP significantly damaged the dopaminergic cells of the substantia nigra and led to an epidemic of Parkinson's disease in young people. So mice maintained on alternate day fasts have a significant reduction in the loss of dopaminergic neurons and improved functional outcome when they are given MPTP. And most interestingly, several transgenic mouse models of Alzheimer's disease have been generated, and they exhibit age-related accumulation of beta amyloid with or without tau and associated learning and memory deficits. And when these mice were maintained for 1 year on either significant calorie restriction or alternate day fasts, beginning when they were 5 months old, they did not develop the cognitive impairment exhibited by mice fed ad libitum. So the transgenic mice that are programmed, if you will, to develop Alzheimer's, calorie restriction or alternate day fasting seem to prevent development of cognitive impairment. So, and lastly, as I said, human data, is somewhat sparse. Here's a very kind of late-breaking bulletin from Nature Reviews Endocrinology, basically a review study, a new review of 21 studies about fasting. And again, it will show you much of what we've already said, that some studies have found there's improvements in blood pressure, LDL cholesterol, triglycerides, insulin resistance, hemoglobin A1C, etc. And it dispels the myth that, quote, people are going to feel weak and not able to concentrate during fasting. People actually seem to concentrate just fine once you take a couple of days to sort of, get used to it. So in conclusion then, intermittent fasting in both human and animal data seems to have, in the last decade or two now, many beneficial effects that you can just look at the slide for yourself and see all of the different effects. It is basically a global summary of all of the different things that we have been talking about. And so when the religious scholars speculated, 1500 years ago, that when we are asked to do something as a show of obedience to God and as a pathway to spiritual purification, they probably are not at all far off in their claim that it is for the global good and that we are not being put in a position to sacrifice our health or our well-being, our physical health, for spiritual health, that actually we are promoting both simultaneously. And I think the data of the last decade or so on intermittent fasting certainly makes a good case for them, and is sort of a good segue into the insightful questions that you have asked me. So I don't know, Ra, if you want me to pick from some of those questions now and start answering them in the few minutes that remain, or?
Yes, go ahead.
Okay, so I was just saying that we do not have to sacrifice our physical well-being for spiritual well-being, and that is the general rule in fasting. Someone asked, what are the general fasting exceptions in case of illness, pregnancy, manual labor? So bottom line, very simple, anytime fasting may cause harm, the obligation of fasting drops. Even if it causes a significant inconvenience, like, for example, the traveler, they do not have to fast. So people involved in heavy manual labor do not have to fast the month of Ramadan. The scholars very early on in the days when prisoners were, put to hard labor, said that and we're talking here about convicted felons, I mean, bad people, when they are being punished by hard labor, they need to be fed during the month of Ramadan and given water to drink. The fasting obligation drops on them. Old age fasting obligation drops, young age fasting obligation drops. And people asked, when should people begin the practice of fasting? it becomes incumbent at puberty. Young children do not have to fast. They probably should not fast. They always want to fast, and you can have them maybe fast a half day or fast for 3 hours or what have you. And people assume the obligation during puberty. When I say, for example, someone who is ill does not have to fast, they don't have to fast the month of Ramadan. When they get better, they should make up the days. That is the religious rule. If they are not expected to get better, like, for example, they are old and frail and you're not going to get better from that, one should still try to maintain a sense of obligation in terms of, for example, expiating the fast by giving charity to feed one poor person for every day of fasting, if you are able. And then, are there medical conditions when fasting is not recommended? Yes, of course there are, and other questions have certainly pointed that out. So type 1 diabetes, it would be quite difficult to fast. There was a very, very insightful question about that there's much support that a negative energy balance such as fasting has been associated with eating disorders and those susceptible. So people with anorexia, we know that they need to maintain a very rigid schedule of eating. And for them, for people who do not have anorexia nervosa, as you may have noticed, going for prolonged periods without food may cause fatigue, may cause anxiety, various unpleasant physical and psychological responses. There seems to be a paradoxical anxiolytic effect of long periods of energy restriction or caloric intake restriction in people with anorexia, and so fasting may predispose them to slip back into a bad situation of not eating. And so, of course, for them, it would be contraindicated, etc. And someone asked, are there situations in which fasting is not allowed? If I wanted to run a study with Muslim participants that required their eating or drinking at specific intervals, yeah, no, I mean, Muslims would not be able to participate in that study during Ramadan. If they needed to do something for their own health, like have a glucose tolerance test that needed to be administered now, yes, you can break your fast for that. But if you want to have a study that involves oral intake, you do not want to recruit Muslims during Ramadan. And someone asked, what additional responsibilities do Muslims take on during this time, and how can we help our peers balance these with medical school and residency practice? I know at UCLA, we got a very nice bulletin that was distributed, across the entire medical school and the faculty, announcing Ramadan and letting the attendings know that medical students on the ward may be somewhat reticent to say, I've been fasting all day, I haven't, eaten anything or drank any water since 4 a.m. Can I please have a few minutes now to break my fast? So all of the attendings were encouraged to be cognizant of that and make time out, whether it's on a surgery rotation or otherwise, for the Muslim medical students to be able to break their fast. And as I said, it's not just about abstaining from food and drink. It is also a month of serious prayer for those who are able to do that. We spend a good part of the night in prayers. So just be aware that, as an attending, your medical students will probably be more sleep deprived than usual, fasting during the day and trying to do some of their additional prayers in the evening. So I think I've picked out a few of the questions. I don't want to hold you too long, but if there are other questions that you would like to read to me, if I know the answer or think I know the answer, I'm certainly happy to attempt. And someone, by the way, asked a very insightful question about von Gierke's disease, glycogen storage diseases, where we're unable to break down glycogen. And of course, people would become very hypoglycemic then if they fasted, because they need fairly continuous energy intake. And of course, that is a chronic condition, and the obligation of fasting would drop entirely.
Thank you for answering all those questions. Does anybody have any questions that were not answered by Dr. Hathout?
Yeah, I just had a question. Thank you very much for this very informative and beneficial talk. I was wondering about the benefits of mobilizing ketone bodies in the fasting state and why that's beneficial for brain metabolism.
I am not entirely sure, to be very honest with you, but the brain is essentially an obligate, glucose utilizer, more or less. And when we are in a state of fasting, we're going to first break down the glycogen, and then we can do some accessory metabolism from breaking down the ketone bodies. But does that have a clear physiologic benefit? I don't know, to be very honest with you. I would have to look into it. It's not something I've run across in my reading.
Okay, thank you.
Sure.
Does anybody have any other questions?
And of course, I guess I should mention what I'm kind of taking as perhaps self-evident, but I've already talked about the behavioral component of fasting, that it's not just abstaining from food and drink. And we've seen the prophetic advice that if you're not going to alter your behavior, you've only gained hunger and thirst from the fast. But what I've taken for granted, of course, is the charity aspect of the month. It is supposed to engender empathy for those who are fasting involuntarily, for those who do not have enough to eat, enough to drink, and do not have the privileged situation that we have. And feeling the pangs of hunger and thirst is supposed to help us become more empathetic to those who are doing it involuntarily. And it is, in addition to the personal behavioral changes, supposed to be a month of significant charity for those who are able to be charitable. I guess that shouldn't be something that goes without saying. I just wanted to make that also clear as an explicit benefit. And this business about increasing empathy is not as fuzzy as it sounds. The field of neurotheology, for example, that uses target psychological battery testing, has shown that daily prayer increases empathy. When you do psychological testing for these things can, in some sense at least, be quantified, and daily prayer, for example, has been shown to increase empathy. So I know it sounds very amorphous and very fuzzy, but there are those who do attempt to quantify such things. And I'm not aware of studies on fasting with those psychological test batteries. But as I said, the field of neurotheology and the effects of prayer has shown some of that.
Dr. Hathout, we have a question in the chat. So it says, I had a question relating back to cancer. Because cancer cells are highly metabolic, can it be assumed that fasting would deprive these cells of the glucose they use to divide?
Yes, and so that's was part of my point in showing the PET scan here. The cancer cells are extremely highly metabolic, and so when you restrict glucose, who are you going to hurt the most? You are going to hurt the cancer cells more than any other tissue. Can I back that up with human data? I cannot. Do we have animal data that says that fasting decreases tumor incidence, yes. Delays the onset of tumors in animal models that are programmed to have tumors, yes. Decreases the incidence of metastatic disease, yes. Improves the response to treatment, yes. And I can correlate it to my direct sort of professional experience that this metabolic difference between, for example, the cancer and the heart is a highly metabolic organ. Look at the difference in glucose uptake between the cancer and the myocardium. That is a massive difference. When we go to the brain, the difference in metabolic rate between the globus pallidus, which is part of the deep gray matter, the basal ganglia, and, for example, the parietal sensory cortex or the motor cortex in the brain is much less than this difference. Same goes for the increased metabolic demands of the hippocampus compared to say the visual cortex. And I'm picking eloquent areas of the brain, let alone so-called silent areas of the brain. And when somebody suffers anoxic hypoxic injury to the brain, on imaging, we very clearly see the preferential damage to these areas that have a slightly higher metabolic rate. The basal ganglia, the hippocampal formations, the Purkinje cells of the cerebellum. Of course, too much hypoxia will damage the entire brain and then kill people, but I'm talking about, when you can discern a difference. And so imagine the vast metabolic gulf between these cancer cells and the myocardium, for example, as a highly metabolic organ. I would imagine, without having hard data to back me up, that if you were to restrict calories and restrict energy, these cells will suffer a lot more than anything else. And again, it's a hard study to perform in humans. I think there is some interest in attempting to do these sorts of things. And, maybe when you guys are giving this lecture to the, medical student class of 2040, we will have that data at that point.
All right, and then I think we have one last question. So it says, I know the topic of overeating tends to be seen in some Muslims during Ramadan, during iftar. Will these tendencies suppress the efficacy of the health benefits that fasting has to offer, or even nullify them?
Yeah, that's an excellent question. Because we sort of follow the Quranic guidelines to fast, but we somehow often put aside the prophetic guidelines about not overeating. I don't know the answer to that. I am not aware of data that has shown, a group of fasters that then overindulge at night versus a group of fasters who don't. The data that we saw, I imagine, is taken from a random group of fasting people. And so the human data that I presented specifically about Ramadan fasting, if I can go back and find that slide, for example, about the reductions of cytokines, I do not believe these 50 fasters were told don't indulge during iftar, during dinner time. So they were probably a random group of Muslims who were fasting, and we still saw rather remarkable reductions. I think going long periods without eating, no matter which way you slice it, will have beneficial effects. Will they be blunted by overeating? I imagine they would be, of course, but that's just my gestalt and speculation. Do I believe they would be nullified? I don't think so. And again, because these 50 fasters are your typical Muslims, some of them are going to overeat during dinner, others will not overeat during dinner. And these reduction rates are pretty impressive. But I mean, it's, as I said, it's a prophetic guideline. I mean, it's a religious guidance, as it is in Christianity. I mean, gluttony is a sin. And of course, I'm now treading the line of serious hypocrisy, because I am one of those who sometimes too often will overindulge at dinner after fasting. I'm trying to get better at it. With some measure of hypocrisy, I tell you that we should do our best not to do that. Okay.
Thank
All
you
right.
very
Well, I thank you all very much. I hope you found it interesting, enlightening, and it's been my sincere pleasure. And for those interested in, and I realize it's a narrow interest, but for those interested in issues of religion and science, or Quran and science, perhaps we can talk later about some other sources or other topics entirely. I'd be happy to do that. All right. Thank you so much.
Inshallah. Thank you so much.
Take care. Ramadan Mubarak to all of you who are Muslim and all of you who are non-Muslim. God bless you and thank you.
Thank you so much.
Bye-bye.
Bye.
لا إله إلا الله لا إله إلا الله لا إله إلا الله ما لنا